So what is A1C and why do we hear so much about it these days? 35 years ago when I first started medical school, A1C wasn't the diabetes buzzword that it is now. In fact, back then, unless you were involved in medicine in some capacity, most people didn't have a clue what A1C was, and most folks had likely never even heard of the term. But over the past 3 decades, that's all changed. As our population has become more overweight and unhealthy, A1C is a term that's gained widespread recognition. But what is it and why does it seem to be such a big deal? Well, hemoglobin A1C, or A1C as it's most often referred to, is a measure of your average blood glucose over a 3-month period, and it gives your doctor an idea of how well controlled your blood sugar has been over the past 3 months prior to having your A1C test done. It works like this. When sugar or carbohydrate from your diet is absorbed into your bloodstream, it attaches to a protein in your red blood cells called hemoglobin. Now, everyone, even non-diabetics, has some blood sugar attached to the red blood cells, but the higher your blood sugar happens to be for longer periods of time, more sugar becomes attached to a higher percentage of your red blood cells, and this is what raises your A1C. And because red blood cells live for only about 3 months before they're broken down or taken out of circulation, an A1C test is able to give us an estimate of how well controlled or how poorly controlled your blood glucose has been over a 3-month period, and consequently gives us an idea of how well or how poorly you've been eating over that period of time. If you're a type 2 diabetic, A1C is an important number to understand because it can give you feedback as to the quality of the nutrition you're taking in on a regular basis. Consequently, A1C can be manipulated. It can be decreased or increased by the things that impact or affect the amount of sugar that ends up in your bloodstream. So what might some of those things be? Well, for one, bariatric surgery can lower your A1C, and it's been shown to be effective at reversing type 2 diabetes. Why? Because bariatric surgery limits the sheer number of calories that a person can physically bring into the body over the course of a given day. But let's face it, there are risks to any kind of surgery, and bariatric surgery is no different. From persistent nausea and vomiting to diarrhea, potential wound infections, bowel obstructions, and nutritional deficits. So surgery as a way to lower A1C and reverse type 2 diabetes is something that should be undertaken with consideration for these potential issues, even though bariatric surgery does have the potential to lower A1C and to reverse type 2 diabetes. Something else that can lower A1C is intermittent fasting, and many people have successfully reversed type 2 diabetes by incorporating intermittent fasting into their strategy to reduce overall calorie and carbohydrate intake. Again, anything that reduces the amount of sugar that reaches your bloodstream in excess will tend to lower A1C. Consequently, low carbohydrate diets such as keto, carnivore, the Mediterranean diet, and even some forms of vegetarian or vegan diets have the potential to lower A1C simply due to the reduction of sugars and processed carbohydrates that most of us are otherwise exposed to when not eating in such an intentional and specific manner as someone who follows one of these low carbohydrate diets. What else lowers A1C? Medications used to treat type 2 diabetes will often lower A1C as well. We're seeing this now with semaglutide, along with weight loss and reversal of type 2 diabetes, because semaglutide causes people to feel more full, and consequently they eat less and consume fewer calories over time. On the other hand, just because a medication lowers A1C, it doesn't always mean that type 2 diabetes is getting better, and this is really important to understand. In fact, many medications historically used to treat type 2 diabetes will lower blood glucose and consequently lower A1C, but in doing so, some medications simply hide glucose away from the bloodstream, storing it as fat throughout the body. So if you're on medications to treat type 2 diabetes and you're gaining weight despite the fact that your A1C and blood glucose seem to be improving, your diabetes may actually be getting worse and not better. And this is a trap for doctors and patients alike. Many patients who get diagnosed with type 2 diabetes as a result of weight gain will end up being treated with one medication and then progressing to 2 or more medications, ultimately with insulin being added as a last-ditch effort to control blood glucose, because the sum total of these medications have resulted in weight gain over time and worsening of type 2 diabetes, all at the expense of trying to lower A1C. Remember, A1C is not the disease. So what's the takeaway here? It's simply this. A1C essentially acts as a mirror. It provides you and your doctor a reflection of the quality of your diet and the amount of carbohydrate you've consistently consumed over the course of the preceding 3 months. Most people have the ability to lower their A1C without resorting to bariatric surgery, and many many people are able to lower their A1C without medication as well. In fact, one of the simplest things that you can do to begin taking control of your A1C and consequently your type 2 diabetes is to start by simply eliminating as many forms of processed food as possible. This means any food product that requires some form of manufacturing before it can end up on your plate is best left on the store shelves. Remember, if it comes packaged in a box, wrapped in cellophane, or it comes out of a factory, it's likely going to be high in simple sugars and processed carbohydrates and will very likely raise your blood glucose and your A1C if consumed regularly. Lastly, I want to encourage you to not be afraid of your A1C. So many pharmaceutical commercials for type 2 diabetes medications focus exclusively on A1C as the thing that must be fixed in order to get better. But A1C is simply a number, and it's a number that can be changed and manipulated by being intentional about how you live your life, how you take care of your fitness, and what you put in your mouth. My goal with this channel is to help you take control of your health if you're struggling with type 2 diabetes, and to help remove the fear that so many people now associate with this number, A1C. Thanks for watching. Subscribe to the channel if you haven't already, and please share this video with someone you think might benefit from watching it. All the best, and I will see you in the next video.